Time to get your questions answered. 270-9933, the number to call. All right, Zorba, we'll start with Nancy from Stoughton. Hi, Nancy.
Hi.
What's your question?
I was just wondering, if a person were to get the normal flu shot now, how long does the normal flu shot last?
Well, it lasts through the whole flu season. That's the theory right now with the flu shots. So if you get it now, it should last the entire season. We don't give a booster because generally that's how it works with flu shots. They last the whole season, and so that'll be, of course, into the early spring.
So if you get a flu shot every year, will we eventually have to get a COVID shot every year?
I think there might be a COVID and flu shot combination. We don't know yet whether or not a COVID shot will be just like, for instance, a measles shot. For measles, we often get, rather for chickenpox, we give 2 shots, 1 shot, then a booster. For shingles, we give 1 shot and then a booster later on. Right now, it remains to be seen whether or not COVID will have to be given yearly or whether or not it'll be just 1 or 2 shots and you're done, just like polio. After you're immunized for polio, you have a lifetime immunity.
So we're going to see if the virus mutates. That's why you have to get a shot every year. All right. Let's go to Renee in Madison. Hi, Renee. What's your question?
Hi. My question is, I was listening to when the doctor was talking about Russia had a vaccine, even though it's from Russia, and we live in the United States. But, how do we know that this vaccine is what the vaccine says it is? To me, I believe that we have to wait on the Lord. That's just me. In Jesus' name.
All right.
I think it's really important to realize that vaccines manufactured in the U.S., any vaccine in the U.S. really is looked at by the FDA, the CDC, to make sure that it is safe and effective. And the fact is we have good science behind vaccines, and we know vaccines work. They work for polio, they work for meningitis, they work for smallpox. We got rid of smallpox, which was an awful killer. And when we have a good vaccine, it will work for COVID.
How amazing is it that there possibly will be a good vaccine within almost a year? I mean, polio was the quickest one, and that took 4 years.
Right. That's it. Well, but that's because we have different technology. Back at the time when Bill Clinton was president, that was the time that we finally were able to actually find the human genome. Now we can find genomes in a matter. It took years and years before we found the initial human genome, but before we were able to sequence it. Now we were able to sequence the genome of the virus in just basically a few weeks. The technology has improved dramatically over the last certainly 20 and 30 years, and that's why we've got a quicker vaccine. We'll get a quicker vaccine quicker to the marketplace where we can always get vaccinated.
Mm-hmm. What's your advice to parents about sending kids back to school?
I think it's a mixed bag. I think you've got to look at each individual school, how well they're doing, whether or not your kids will wear a mask. How well is it to actually get a 6 and a 7-year-old to wear a mask? Very difficult. High school students, once again, there are difficulties and there are challenges, and it's very difficult. You've got to look as a parent, as an individual decision, how many kids are in the classroom, whether or not they're using safety matters, and then you have to look at your own situation yourself. So there's not a black and white answer here. And if you notice, I'm skirting the question because I don't have a clear answer of what I would do if I had children who had to go to school right now. I certainly would pay attention to what was going on in the school. And I would realize, for instance, that all sports are canceled because I wouldn't want my kids coming into contact, in close contact, especially in a sport like soccer, with other kids who might have COVID. To me, that's a very difficult situation. So I think sports are really, which often go along with schools, are something that definitely should be canceled this year.
All right, let's go to Barb in Portage. Hi, Barb. What's your question?
Yeah, Zorba, I am calling from Portage, and my question is, my roommate and I wear our mask when we go out, and we respect you and what it is, and the problem is a lot of people don't respect our wishes because they don't respect our wishes. What does somebody do?
Well, I think on a personal level, you can tell people, hey, you should wear a mask. It's really important. And I think you'll actually save lives by wearing a mask. and let's look at the science. I think you just do it on a one-to-one basis individually. It's a shame that public health has become a political football. It shouldn't be a political football. Just like we don't spit in public, just like we wash our hands after we go to the washroom because we want public safety, that's why we should also wear a mask. I may infect you. That's why I'm wearing a mask. It's for your safety, just like we drive correctly on the street. It's simply a matter of what we should do as good citizens. And that's what you say to people, and you just hope people will catch on. Look, I never thought that no smoking would ever occur in a tavern in Wisconsin. It took a long time before we convinced people that we should not smoke in public, in restaurants and in taverns. People will eventually be convinced by the public health of a mask, just like we buckle up for a seatbelt. Those are the important things, and one-to-one basis, try it.
Absolutely. It should not be a political thing. It's a science thing, a health thing. All right, Zorba, we're out of time. Thank you all for calling in. We'll see you next week.
Take care.
Thanks, Zorba. Great to see you.